Unit 16 Musculoskeletal System 4 75. A client has had a bone scan done. The nurse would evaluate that the client understands the elements of follow-up care if the client states that he or she should 1. Report any feelings of nausea or flushing. 2. Ambulate at least 3 times before the end of the day. 3. Eat only small meals for the remainder of the day. 4. Drink plenty of water for a day 2 following the procedure. The correct answer is 4. Drink plenty of water for a day or 2 following the procedure. 76. A home care nurse is visiting a client who sustained a severe muscle sprain to the back. Cortisol is prescribed for the client and the nurse provides instruction to the client about medication the nurse teaches the client. 1. The muscle spasm will reduce but the pain may increase. 2. To try to avoid missing dose, but if dose missed, to take as it soon is remembered. 3. To limit alcohol consumption, 2 drinks daily while taking the medication. 4. To avoid driving until the reaction to the medication is known. The correct answer is 4. To avoid driving until the reaction of the medication is unknown. 77. A client arrives in the emergency department after sustaining an injury to his arm from a fall. An X-ray is taken because a fractured radius is suspected. The nurse is able to see the X-ray as it is being reviewed and notes that there is a complete fracture across the shaft of the bone is splintering of the bone into fragments. The nurse concludes that the client has sustained which type of fracture? 1. Green stick fracture. 2. Comminuted fracture. 3. Compound fracture. 4. Simple fracture. The correct answer is 2. Comminuted fracture. 78. A client speaks treat in the emergency room for lower leg injury. There is visible deformity of the lower aspects of leg and the injured leg appears shorter than the other. The area is painful, swollen and beginning to become asymptomatic. The nurse interprets that this client has experienced a 1. Contusion, 2. Fracture, 3. Sprain, 4. Strain. The correct answer is 2. Fracture. 79. A nurse is caring for an elderly client who has been placed in buck extension traction following a hip fracture. On assessment of a client, the nurse notes the client is oriented. The most appropriate nursing intervention is to 1. Ask the family to say with the client. 2. Apply restraints to the client. 3. Ask the laboratory to perform electrolyte studies. 4. Reorient the client frequently and place a clock and calendar in the client's room. The correct answer is 4. Reorient the client frequently and place a clock and a calendar in the client's room. 80. A nurse is one of several people who witness a vehicle hit pedestrian at fairly low speed on a small street. The person is dressed and tries to get up. The leg appears fractured. The nurse would plan to 1. Stay with the person and encourage the person to remain still. 2. Assist the person to get up and walk to the sidewalk. 3. Leave the person for a few moments and call an ambulance. 4. Try to manually reduce the fracture. The correct answer is 1. Stay with the person and encourage the person to remain still. 81. A client has been diagnosed with osteomalacia or adult rickets. The nurse determines that the disorder, when it affects an adult, results from the deficiency in which of the following vitamin? 1A, 2D, 3E, 4K. The correct answer is 2D.